What can you do to fix your knee pain? Start with activity modifications. So when you first start getting pain, if there are certain activities that bother your knee, then just stop doing those things for a little while. And it might seem simple, but it's true. So if you keep aggravating your problem or creating more inflammation because you keep trying to push through the pain, then you essentially can sort of drag out a condition which otherwise your body would have gotten rid of fairly quickly. So start by modifying your activities. Use ice or heat potentially. Ice is good to reduce inflammation and swelling. Heat is actually good to bring in circulation because it opens up those blood vessels to promote healing. So you can do a combination of ice or heat, whichever really makes you feel better. There is a role for bracing if you're having some instability or if you need a little bit of compression in the knee. Putting a knee brace on for some support can be very beneficial for a period of time. And then the last thing would be medications for your discomfort. I don't love to take medications to treat your symptoms, but in certain situations, anti-inflammatory medications like Advil, Aleve, and Motrin can be very helpful to reduce discomfort in the knee and to reduce swelling. It's important to make sure that those medications are potentially dangerous if you have heart problems, stomach issues, or kidney problems. So if you're not sure, it might be a good idea to check with your doctor. Other things that can help with your knee problem, I am a big fan of stretching, especially if your issue tends to be a strain of the muscle or a tight muscle. If the IT band is the culprit, then doing stretches to stretch out that IT band can help relieve your symptoms. So definitely a role for stretching your knee. And then ultimately, once the symptoms have calmed down, then a strengthening program to prevent injuries from happening again. A lot of discomfort that we get in our knees is actually due to deconditioning. Sometimes you're just not very used to doing a lot of physical exertion, and then you do something happens, you're walking all day or you end up doing something very strenuous that you're not used to, and that can aggravate your knee because it's just not used to that sort of pressure. So doing a strengthening program, a low impact strengthening program as part of a maintenance issue or a maintenance program can help prevent having further injuries down the road. And then if all else fails, you've done all the conservative treatment and your knee pain hasn't gotten any better, or if there is locking or swelling associated with your problem, then go see a physician and get this thing figured out. Oftentimes, x-rays can give a diagnosis. If x-rays are non-diagnostic, then MRI scans can be very helpful to figure out where the source of the pain is coming from.